So healthcare is one of the questions I feel like when clients come in, they're the most confused about that because it is confusing. And there's a few different areas that we'll talk about today. Yeah. One is pre-retirement. So what are things changing in that realm as we head into 2025 around private insurance? You also have the window of when folks leave a job, but they're not 65, and how do they go about finding coverage? That's another fascinating thing. So many folks, clients of ours, they worry so much about getting to 65 because of health insurance.
Right.
Now, but I'm like, well, if we just plan to pay a little bit extra for a few years,
you're fine.
You're fine.
Yeah.
So that's another area. And then the final piece we'll get into is when you are retired, you have Medicare, right? So maybe we'll start with that, if that's all right.
Sure. Obviously, when you turn 65, you get access to Medicare. Medicare A starts right away, has no premium. It's not free. You've paid for it. Your employer has paid for it. You and your employer both pay 2.5% of your pay every week. So every time you get paid.
When they say it's free, it's not.
It's not free, okay? Yeah. But if you did not work more than 10 years and you came to my office and you needed Part A, I'd be billing you about $550 a month for that Part A coverage. That covers the hospital stuff. That's why people always think Medicare is so much better. It's because we start $550 a month. We got a head start.
Yeah.
It's something that's worth $550 a month you're getting for $0 at that time because you've already paid for it. And if you're still working, for a lot of people, staying on their employer plan makes sense. For some people, it doesn't. Some people, they can get off of their employer plan and join Medicare, pay the Part B premium. For most Americans, it's $185 a month per person for Part B. For a lot of your clients, it's not the case.
Yeah.
Where they have to pay more for that. And I have an appointment later today with the business owner. I've been trying to get him to convince him to go to Part B. Yeah. But he owns a place, and he'd be paying the highest premium amount. Exactly. And it just kills him. He just refuses to pay it. And that's a big part of where SHP and Brabo come together.
Yeah.
Is that Part B planning. So A is the hospital bill.
Yep.
It pays 80% of the hospital bill. B pays essentially 80% of doctors' lab x-rays. And then we're left out there not having C.
Yes.
C and D, which are making up those 20%, and the prescriptions is Part D.